On March 13th, the United States Citizenship and Immigration Service issued some clarity on the issue of public charge in a time of coronavirus. Now, the language coming out of Homeland Security, that USCIS office, says that if you think you are exhibiting any symptoms of coronavirus, you are encouraged to seek treatment promptly, and that will not be used against you should you change your status later. Now, the USCIS maintains that the rule itself does not restrict access to testing, screening, or treatment of communicable diseases, and COVID-19 or coronavirus is in that category. So the rule itself does not restrict access to vaccines for children or adults to prevent vaccine-preventable diseases, and of course they add the asterisk if a vaccine for coronavirus becomes available in the near future. Now, one of the things to take away is that USCIS will not consider testing, treatment, or preventative care related to COVID-19 or coronavirus as part of the public charge inadmissibility determination. And that is very clearly stated on the USCIS website, and we link to that in the description below. Now, it also says that this won't be used against you. It won't be a negative factor, even if the treatment is provided or paid for by public benefits like Medicaid. And that's really important clarity. Now, there was some request much earlier from 17 attorneys general that wrote a letter to USCIS and Homeland Security. This was led by Washington State, and you might remember Washington State has been challenging the public charge rule since its inception. But they asked, the 17 states asked the Trump administration to delay the new public charge rule in light of the coronavirus outbreak. Now, Homeland Security has not delayed implementation of the rule, but this clarity most likely comes as a response to that request from the attorneys general. They wanted to pause the public charge rule to try to encourage people to seek treatment in this very new circumstance in which we find ourselves. Well, the rule itself is still in effect, but be clear that coronavirus treatment or testing cannot be used as a negative factor. Now, there were some additional public benefits considerations that some people had questions on, so the guidance also does give clarity to this as well. Other public benefit use during the social distancing or quarantine should not be used against somebody as well. And let's give you an example of that. Let's say that somebody is working in a restaurant or in the service industry, and because of coronavirus, they are told to stay home. Now, what the United States Citizenship and Immigration Service suggests is that that person, if they do have to use public benefits of any kind because of that quarantine or self-isolation, should simply provide an explanation and relevant supporting documentation should they then go through a status change interview. Now, that letter or documentation is going to be really helpful in describing the circumstances, but this is all new. And remember, public charge itself is a totality of the circumstance test. How many public benefits or cash benefits are you using? Are you likely to become a public charge? This is a very subjective test. The more clarity you can give in the explanation for whatever benefits you're using could be helpful later. So this advice coming out of USCIS is helpful, but don't let that be the only advice you seek. If you are changing your status, and consider that you might be going through a public charge determination when going through an interview in the future, make sure you seek your own counsel so that someone can help you evaluate your totality of the circumstances. Now, in the description below, like we mentioned, there is that statement from USCIS where you can read about public charge in an era of coronavirus in its entirety. We also give you that link to the National Immigration Legal Services Directory so you can have some help finding some legal advice about your particular situation.